This is the Critical Conversations podcast, a KPOV special project developed to feature unique perspectives and the courage it takes to go there, challenge mundane thought, and question the norm.
As women age, there's a growing focus on healing the pelvic floor region, whether it's for sexual intimacy or incontinence. And this isn't always an easy subject to talk about. And for young women as well, they can struggle too. So our guest today is Mackenzie Van Loo, a physical therapist in Bend that focuses primarily on the pelvic floor region. So welcome to The Point, Mackenzie.
Hello. Thank you so much for having me. It's a pleasure to be here.
Yes, we're excited. So, Mackenzie, we had Dr. Carol Petherbridge on our show, and she was talking about the very same issues. But I wanted to have you on because of your vast knowledge in this area and the idea that, a lot of people don't know that physical therapy in the pelvic region can actually help women. So let's dig in. Tell us what is pelvic floor physical therapy?
Great. Pelvic floor physical therapy refers to this subset or this subspecialty in orthopedics. So in physical therapy school, doctor of physical therapy school, we get permission to treat the entire body from an orthopedic and neurologic standpoint. After school, there are hundreds of hours of classes that you take in order to get permission to work on the pelvic floor. So just like everything else in your body needs to have strength, endurance, range of motion, coordination, and power, both locally and as a system, your pelvic floor is the exact same. So I use my PT brain for strength, endurance, range of motion, coordination, and power for helping people solve their issues around the pelvic floor. So things like urinary incontinence, urinary urgency and frequency, constipation, pain with sex, pain with orgasm, or even chronic pain like in the back and hips that doesn't really solve or get better with normal classic PT.
So that's fascinating. Go ahead, JC.
How do you know when it becomes severe enough to need the therapy itself?
That's a great question. I think there's that old adage of an ounce of prevention is worth more than a pound of cure. Many times, especially let's use some low-hanging fruit. Pregnancy. Pregnancy is something that changes your body from the inside out. Getting to know how to use your pelvic floor before you become pregnant is actually really super helpful. I help people actually figure out how to push efficiently in labor, how to strengthen those muscles. So we tend to say, if you leak any urine or have any loss of the control of your pelvic contents, so pelvic organ prolapse, you maybe have to rush to the bathroom for bowel or bladder, or you leak even just a little bit with a sneeze or a cough, or even with a PR deadlift. All of that stuff is really common, but it doesn't have to be normal. Now, I don't want to ever to spread a stigma that you should be ashamed of leakage, like common but not normal can have some weird connotations. But if you feel like you don't want to leak, you definitely don't have to.
That's a great information, because, I don't know why it's so hard for women to address it, whether it be sexual intimacy or incontinence. Do you think the tide is turning a little bit now that where women are saying, it's not okay to leak. It's not okay to, even young women, not be able to use a tampon or, or not be able to have a successful orgasm? I mean, do you think the tide is turning where women are okay to talk about this?
I think so, yes. Like with change, like younger and younger generations being more and more okay with talking about things that, are taboo to some others, it definitely is changing the tide. Now, is it as fast as I'd like it to be? Probably not. But I think as people become more aware and become more comfortable, that's where it's a great, I think the tides are turning. But again, not as fast as I would like.
So do you feel like a lot of people experience these problems with their pelvic area, but they are not aware of the solution of physical therapy, so they often go untreated?
Yes, actually. I should have refreshed my mind on statistics, but I believe it's 1 in 3 women over the age of 65 have urinary incontinence. And I can confidently say that's only 1/10 of pelvic floor dysfunction. That's not counting all the other things that I've listed and more. pain with sex is extremely prevalent, especially after having a baby, or even as we age. Our tissue dries, our pelvic muscles get tighter, and becomes painful. So yeah, it is actually extremely common. It's also 1 in 3 to 2 in 5, something like that, of young athletes, like collegiate athletes, actually leak. These are women who have not had babies. And men have pelvic floors too. They also leak and have pain with orgasm. They also have constipation. They also have all these issues. So yeah, everybody.
Fascinating. Mm-hmm. Wow. I want you now this is why I really wanted to have you on, because I found it really fascinating how physical therapy can work in the pelvic area. I mean, I know I've been in for my shoulders, and they move my shoulders and stretch my shoulders, and, and I've been in for my hip, and they, do things, but can you just geek out a little bit and tell us how the nerves and muscles relate to the pelvic floor area and why PT would be good for it?
Oh, thank you. I love this question. So the pelvic floor, and think of it this way, your body is like a team. So just like you are a team with your co-host and you're a team in your family, everybody has their roles to play. And short term, if we drop the ball or we're sick, and someone else can kind of come along and help take up the slack. Long term, that's when the person who's taking up the slack can get a little frustrated, a little extra tired. Their duties start not doing as well. That's exactly how the body works. So your pelvic floor and its capacity to do its job is also dependent on all the other muscles and structures that attach on the pelvis. So everything from your neck and your jaw and your throat all the way down to your big toe affects how your pelvic floor is able to do its job. You are you are actually like 80% likely to have some form of pelvic floor dysfunction if you also have back pain or hip pain. So anything that attaches onto the pelvis, like the hip, like your vertebra, like your abdominals, if they do not have appropriate strength, endurance, range of motion, coordination, and power, locally and then as a whole system, your pelvic floor many times is the last-ditch effort, that team member that's always trying to take up that extra work. So pelvic floor physical therapy includes looking at those shoulders, looking at those hips, looking at the back, and making sure that the nerves, the bones, the joints, the muscles, everything works together as a team.
Wow. So does all of the work encompass? I'm not quite sure how to say this. Is it done on the outside, or is it done? Some of the work done vaginally?
Yes,
or internally.
Perfect question. Yes. So part of becoming a trained pelvic floor physical therapist, I get permission to and significant training to assess the pelvic floor muscles externally and internally. That's either through the vagina or through the rectum, depending on the problem. So tailbone issues would be through the rectum, constipation, lots of stuff through the rectum as well. But it also includes external, like we had just said, and really thorough orthopedic assessment of the hip, the low back, the pelvis.
And before the show, you had mentioned that it is not common for people to be as specialized in the pelvic region as you are. Could you expand on that and why it's important to have someone who's super specialized to perform this kind of therapy?
Oh, yes. Thank you. So, yes, I am the only board-certified women's clinical specialist in Central Oregon. There's only 12 of us in the state and only a couple hundred of us in the whole United States. It's just extra hundreds of hours and then a big exam and a big case study that's reviewed. So it's just taking those extra steps to make sure that I have other people more advanced than I looking into my career and saying, are you doing the best for your patients? Now, there are plenty of people that practice very well that do not have this certification. It's just what I chose to do. But doing these certifications, I also have my clinical specialty in obstetrics and gynecology, and that's given me extra training to help someone prepare for birth and recover from birth and keep training during birth. I have my postpartum athleticism and pregnancy coach certification as well. So having more specialty means I've spent more time really critically thinking about the research and what is a science-based way for me to help people. But again, not everybody needs super duper specialized care either, right? So it's called a physical therapy practice and a medical practice. So as we practice more in our careers, we get better and better. And so I just like to pursue knowledge a lot.
What do people say when you tell them what you do? I mean, what is the big question that people ask when you say this?
It always depends on the people in front of me. Most moms nowadays know what I do. I say pelvic floor PT, and they're like, "Oh, I should come see you," which is super flattering. Now, if I'm with my husband's coworkers and they ask what I do, most of them, because they're engineers, go, "Oh, well, interesting." And then the conversation switches. So it always depends on who's in front of me, right? It can be very taboo. There's this really uncomfortable stigma that my job is somewhat sexual, where we do talk about sexual health in a very, very matter-of-fact and informative way. But yeah, a lot of people have some really strange connotations around the work that we do, but I think it's justice work. Our capacity to feel like adults and human beings has a lot to do with our capacity to control urine, control bowel, and have pain-free intimacy with the people we care about. And that's why I do what I do.
That is great.
I love that. One of the things I wanted to bring up was pelvic floor therapy for the trans population, for children and for men. I know we've been talking about women's issues. Tell us a little bit about those issues that you deal with.
Yes, thank you. So everybody has a pelvic floor. The pelvic floor tends to get a lot of press for people who are pregnant or have babies or want to have babies, but also just individuals who are struggling with gender dysphoria, people who are unhappy with their body, people who've had sexual trauma, people who've had prostatectomies, even young children who bedwet late into childhood. All of those things are something pelvic floor physical therapists can help with, especially ones that have advanced training and are, of course, comfortable treating those specialty populations. I say specialty populations because that's what the physical therapy groups say. I think that they should not be specialty. They should be basic, right? Everybody has a pelvic floor. Everyone deserves to have care and not have difficulty with orgasm, pain with intercourse, or significant post-surgical pain. So post-bottom surgery, post-gender affirming surgeries. The pain and the surgeries are absolutely amazing and intricate. And these people need physical therapy. It's painful. And so I pride myself in being able to help people with that. It's a privilege to help trans individuals recover and feel more at home in their bodies.
Well, that the children bedwetting. I know a lot of parents are concerned about that. How would you treat a child who bedwets?
Most of the time, it's not always, but a large majority of the time, children who bedwet late into childhood are actually constipated. So if you think about the pelvis, it is a really small container, and it holds bladder, uterus for those who have a uterus, and your rectum. Your rectum and your bladder are very close. If your rectum is full of hard poop, can you imagine how that would really encroach on space on the bladder? And just holding that toxic stuff inside your body will also just upregulate your nervous system and make it harder to control urine. So treating kids, a lot of the time, we use biofeedback externally, or I use actually lumbopelvic real-time ultrasound. So I'll use a very friendly little ultrasound wand, like what people use to look at ultrasounds for babies. We put that on their tummy and we can actually measure their rectal diameter and know what's normal and see if they are full of poop. And then we work really closely with their doctor, their primary care, to help them get cleaned out, get them and their parents on a schedule for helping train them. If there's sensory processing disorders, we also get OT involved. Yeah, it's again, holistic, a big picture for treating kids. I love real-time ultrasound. It makes treating them so much easier. Because, it can be kind of intimidating to do PT, especially for the kids.
Yeah, I did not know all of that. But how is treating men different than treating women?
Well, for those that identify as male, there's, again, in our society, a lot of things we grow up with, right? A lot of things that tell us who we are and whether or not it's okay to talk about things. And I think generally as women are more okay with talking about medical issues than maybe some of our male counterparts. So treating men is different in that we have the privilege of teaching them about their body in a way that's never really probably not talked about very often. And treating men, I treat a lot of people with erectile dysfunction, teaching people how to care for their tissue after a prostatectomy to help them not leak, but also help them regain the capacity to have erections. Yeah, lots of stuff. But I mean, I see men for all the same things I see women for, all the same things I see trans individuals for. Bowel issues, bladder issues, constipation, hemorrhoid stuff. Yeah, all of it. All of it.
Well, I know, JC, you had mentioned that you had known a friend who had received the therapy and had an experience with it.
Yeah, she actually had tremors around the pelvic floor, and then she received 3 sessions of pelvic massages. And afterwards, it was quite painful for her. So I was wondering, does pain often go hand in hand with the therapy, even though she did receive relief for her problem after? How does that affect people who received the therapy?
Yeah. So we like to say, so I'm of the school that says this isn't necessarily something that's all gain, no pain. No pain, no gain. There we go. No pain, no gain. It is a popular saying. And while there are times like in tendon rehab, yeah, pain is definitely part of rehab. The pelvic floor and the pelvis, it's a really intimate area. And even when people have pain with gynecological exams or pain with a tampon insertion, pain should always be tolerable. It should always be tolerable and should never really pay for it afterwards. Now, there are times where I do prep patients for that, but generally there are advanced manual therapy ways that we can treat people and really put their nervous system at ease, both like cognitively, but also physically help downregulate the nervous system so pain is almost not a factor at all.
One thing that you also mentioned is you get a lot of questions related to Kegels. Is this equivalent to pelvic therapy, or what are your comments on that?
Thanks for bringing that up. Yes. So many times I say, I'm a pelvic floor physical therapist. They're like, I do my Kegels. I'm good. And I am of the thought that unless you literally just gave birth to a baby or have a ton of pelvic floor length, doing Kegels is actually not pelvic floor physical therapy. There is maybe 10% of my practice where I will prescribe them. It actually has to do with treating your whole system, like we talked about, making sure your abs, your low back, your butt, all the other big muscles that are meant to locomote you through your day, those things actually need to be trained. There's really great and really clear evidence to show that if we just get your whole body strong, your pelvic floor will do its job. We just have to be smart about it. So yeah, it's definitely more than just Kegels. And if you ever have gone to therapy and only have done Kegels and only been on your back the whole time, and you didn't get what you wanted results-wise, it's always worth looking elsewhere. Yeah, it's more than just Kegels.
Well, we're running out of time. We have about a minute left, but I just want to say that I have, full disclosure, I've been to Mackenzie, and the way you practice is so safe and so comfortable that I want to assure people who are maybe afraid or feel like, scared by this, that Mackenzie makes it very, very comfortable and explains everything so that it all makes sense. So Mackenzie, in this next minute we have, tell people how they can get a hold of you and how they can learn more information about this.
Thank you. So you can find me on Instagram. I am the Sanctum Physio on Instagram. You can also find me through movementx.com. I am the only person in Bend practicing and contracting my LLC through MovementX. I'm accepting new patients. I've opened my own business, and I go to people's homes where they can be more at ease. And I also have a private treatment space in my own home. And I just take a lot of pride in, and I feel very privileged to do what I do for Central Oregon. So Jackie, thank you for sharing your experience with me. It is so meaningful to have that feedback. It's a pleasure to be here.
Thank you so much for joining us today. It's been a pleasure talking with you.
Oh, my pleasure.
You've been listening to a KPOV Critical Conversation. To hear more engaging interviews on important topics, please visit kpov.org/criticalconversations.